Hey everyone, it's Reena Jadhav here, founder of Health Boot Camps, hanging out at HP for the SplashX Invent Health Conference. And I'm chatting here with AMBAR BHATTACHARYYA, who's a partner at Maverick. Welcome.
Thank you so much. I'm so excited to be here with you.
So what does Maverick do and why are you interested in mental health?
So Maverick, we're an investment vehicle. We have a hedge fund as well as a venture fund. Our venture fund's about a $400 million vehicle. We invest half of that in healthcare, mostly in digital health, as well as a little bit of biotech as well. We're excited to be here. Mental health is a big focus area for us. We've been investors in companies such as One Medical and City Block and Vator, which are very primary care focused, but embodying the mental health as well. It's a core part that's been ignored in the health system for far too long. We've made some direct investments in mental health, behavioral health tech companies like Olympics Health, and I'm excited to be here to talk about more of what we've done, but also in reality just to learn from others here too, because this is a real need for us as a society and as a sector to deal with this problem.
So what kind of companies do you invest in? What's your portfolio look like?
Yeah, we're mostly early stage investors, so think of us as Series A through Series C. We'd like to get in early, kind of $5 to $20 million investment checks, be on the board and be helpful. We like to be there as an entrepreneur, is thinking of his or her idea, helping them get to market, helping them understand what the customer needs are, and then helping them succeed in that. And that's really the stage we like being in.
And there's a lot of companies in that stage right now looking for funding. So how do you distinguish, and this is more for you entrepreneurs out there that are going, all right, am I the right company for Maverick? What does that checklist look like? So do you need to have customers? Do you need to have a product that works or MVP stage? Talk a little bit about what does that checklist look like? Yeah,
I think it's different for different stages. So if you think about the seed stage, so really early investments where it's a person or a team with an idea, I think what we're looking for is some sort of spike. And by spike I mean some differentiated passion or story that is driving their motivation in a unusual way, or some sort of idea that hasn't been tried before, and it sounds a little odd or out there, but we love the fact that they want to spend their time, energy, life on flipping that card and seeing if it's real. I think as we go later stage, to venture stage, I think we're looking to see evidence that flip is working, right? So that can mean seeing patients or customers or revenue in the bank or distribution. Any of these things for some of our clinical companies have safety data or efficacy data. So things in that realm. So it changes as a company goes on.
And what does the due diligence process look like? So do they come meet with a partner first or an associate? Walk us a little bit through the process.
Yeah, for most of our healthcare companies, they'll meet with, there's 3 of us as partners. They'll meet with one of us. And we'll go and do a meeting, we'll do some diligence as appropriate depending on the stage. At some point in time, they would meet all 3 of us. And because we're a small team, we can do that in a very fast basis, right? And I think that speed we have because of our size, lets us get to know companies faster and entrepreneurs faster, which we think is an advantage in terms of working with people.
What are you looking for?
I think what we're looking for, in healthcare, I think there's 2 ways. One, I think most importantly here is we're making sure that they're really solving a problem for patients and the community at large. You think of companies like City Block, which is focused on the Medicaid population. It's underserved. There hasn't been much innovation there, in the private sector and even in the government sector. You can expand it there. We're taking a primary care model, wrapping around with social determinants, with behavioral health, with home health, all into one to try to care for this community that hasn't been cared for before. So in that situation, we're looking for an idea that hasn't been tried and can scale. If you look at just the number of Medicaid patients or members in the U.S., we're launching in Brooklyn as our first clinic. Just even in Brooklyn and New York as a whole, there's millions of Medicaid recipients, and so you can imagine the idea scaling very fast, and we like to see that too.
Yeah, absolutely. Let's flip around the conversation a little bit. You've invested in some companies. What are you seeing being the biggest challenges that your CEOs are facing in executing today?
I think, when in healthcare in particular, I think one of the biggest challenges is go-to-market. How do you actually go through the sales cycles if you're selling to a payer or provider? Those are long. Those are not 1 to 3 months, those are 6 to 9 months. How do you get enough feedback there, you know, in a fast fashion? When you compare to technology, where the product market cycles are you know, sometimes weeks. You can iterate on your product faster, and I think in healthcare, because of the slow pace of the sales cycle, there's a slower pace of the product innovation cycle too. And so that's where really we're focusing our teams on, is try to get through those cycles faster. Even if the sales cycle is slower, how do you make your product cycle faster, right, so that you can actually win in the long term?
That, I think, go-to-market has been where most companies just fall off the cliff. Yeah. They're just not able to achieve that conversion. Is pricing a factor at all?
You know, what's one nice thing about healthcare so far we've seen is that the pricing appetite from payers and providers, pharma companies, self-insured employers, we think the pricing appetite is there, and we'll knock on some wood that doesn't change this comment. So that hasn't been the issue, and then the other issue hasn't been churn. I mean, like once you're in there, you are in there. It's just how do you get all the decision makers lined up in a way that they can get to a yes and implement you fast. I mean, those are the two challenges that we've seen.
Okay. And where have you been surprised and delighted with the results? Like what's actually working? And this is trying to, again, get the entrepreneur some sense of, you know, from the battlefield, right? Like, where's the opportunity?
You know, I think one really contrarian idea that we've seen play out in a couple of our portfolio companies is going direct to consumer. Yeah. And this is something that most healthcare investors will say, don't try it, consumers don't pay for anything, patients don't pay for anything, insurance companies do. We've seen in our portfolio company, and actually also outside of it, a growing appetite for consumers to start paying for health and wellness. So you think of things like One Medical, where there's an annual subscription fee, things like HIMSS, where you're paying directly for pharmacy outside the insurance realm. Things like Headspace or Calm, where you're paying for meditation and wellness activities. Anything in the diet, exercise type realm, could be even an Equinox, right? I mean, people are really,
there's this awareness.
Awareness and willingness to pay.
And willingness to pay.
And I think you can measure it. I think with meditation, I think there's a measurement aspect to it. Same with your health, I think, broadly speaking. So I think that's what's changed, and I'd actually encourage entrepreneurs to think more about these direct-to-consumer models, which have really been poo-pooed on before, and I think now we're at this stage where people are really paying for that.
Could you talk a little bit about what is the profile of that consumer? Because it's not everybody. There's a group of people that are happily going around spending money on things like Calm, or describe a little bit of that profile. What's the age group?
Yeah, it's a distribution again. I think when you think about things like Headspace or Calm, one thinks of it as gravitating towards a younger population, things of that sort. But I think the flip side of it, which is again maybe counterintuitive, is with the growth of high deductible health plans, people's deductibles in companies are in the thousands of dollars, right? And so there's a huge first dollar component. So you're starting to see families pay for this more too. A lot of moms, a lot of people with kids, parents. That's where we're starting to see more and more.
The moms, the female buyer.
Yeah.
So we're starting to see that. Wonderful.
Yeah.
Any parting advice for an entrepreneur in the healthcare space? What's the 1 or 2 tips for them?
The 2 things I'd say is iterate fast. I was meeting with an entrepreneur today, and they had been for 4 years building a product that they thought would go and be amazing, and they had not yet talked to a single customer in 4 years.
They still exist, those entrepreneurs?
They still exist.
Really?
And so my one piece of advice to them was, gosh, like this is amazing theoretically, but really go out there and talk more. So that's one piece of advice. And 2 is test pricing as fast as you can, because in healthcare, for the most part, there is upside to whatever pricing you think is there. So I would recommend those 2 things.
Wonderful.